says it's ready to begin with the COVID-19 vaccine rollout for the elderly come Monday. Senior citizens are encouraged to register for the jab, but some are criticizing government's rollout plans, saying it is slow and inefficient. It plans to vaccinate over 16 million people in the next 6 months. Well, to unpack the Eastern Cape's Phase 2 vaccine rollout readiness, we're joined this morning by Dr. Sibongile Zungu from the province's health department. Dr. Zungu, very good morning, and thanks so much for your time. In recent days, we've seen praise for the Eastern Cape for its minimal infections at the moment. So how are the numbers looking as we speak this morning?
Iveka, we are very concerned at this point as the Eastern Cape because we are seeing a steady rise in the numbers. And we are seeing this rise in the areas of Nelson Mandela Bay Metro in the main and Buffalo City Metro and Sarah Baartman. Sarah Baartman and Nelson Mandela Bay Metro are responsible for almost 50% of all the infections that we have in the province.
Have you been able to identify why those particular areas and what's happening there ahead of, Phase 2 expected to start on Monday?
Those two areas, they are, like Sarah Baartman is a gateway into the Eastern Cape from the western side. And when you look at the movement in the province, then the movement is from Sarah Baartman to Nelson Mandela Bay and to Buffalo City Metro. And also the ports of entry in both Nelson Mandela Bay Metro and the Buffalo City Metro. And so it's areas that are exposed and at risk most of the time.
All right, let's talk about your readiness for Monday now in light of all of this. Does it put a spoke in any of your plans for rolling out Phase 2 for senior citizens?
We have really been impressed by the rate of increase in the registrations of senior citizens. We had a slow start, and we have seen the numbers rising. And just yesterday, we had almost 50,000 new registrations of senior citizens. At this point, we are standing at 149,000, almost 149,902 senior citizens registered. And we have cautiously limited the number of sites where we are going to be starting on Monday, because in the main we are starting with a new vaccine that we have not been handling since we started the vaccination program for healthcare workers. And because of that, we have limited the number of sites but ensured that all the districts have a site. And we have also ensured that we do not have, because of this risk of a third wave, we have to limit the numbers of people over 60 that present at healthcare facilities. So we are going to go to our old age homes, assisted by our Department of Social Development, and they are assisting us to guide the entries and the registration, the administrative work for old age homes, and our healthcare workers will be doing the vaccination.
Dr. Zungu, we know the Eastern Cape is one of the more rural provinces in the country, and like you say, you've seen quite good numbers in terms of registrations for senior citizens, but how have you managed to reach those sort of in the most rural parts, and especially with infrastructure, as we know, being a problem in terms of getting them registered and in terms of getting them vaccinated? How are you going to overcome those challenges?
I cannot agree with you more around the challenges of the vastness and the rural nature and the topography of the Eastern Cape. And because of that, our registration platforms are quite variable. We do have the online registration and the cell phones and the USSD, but the reality is there are those elderly people in the rural areas that require assistance. So we have partnered with the Department of Education to utilize the schools to first hand out the information with the school children, to sensitize their grandparents, and then we have work where we have administrative people that are going to assist with the registration, and also our clinics that are in the rural areas. When the elderly are coming there for their medication or for their ailments, then they are also getting manually registered by our health workers who enter them into the system. And we are also, again, working with the Department of Social Development. We are also targeting the pension payout sites, where we are having the admin people assisting with the registration and giving us, the Department of Social Development and SASSA have been assisting us with giving us the numbers of people that are of age 60 and above that come to the certain point. Then we know that in this locality, these are the numbers of the 60 and above. Our municipalities also are working with us in terms of mapping out where the above 60s are, and they are helping with the registration. In the rural areas, the registration is in the main in that manner.
So you seem to be finding them then as well. Thanks very much, Dr. Sibongile Zungu there from the Eastern Cape Health Department, just assessing their readiness for Monday, phase 2 of the vaccine rollout, and that is for our senior citizens, that's 60 and over. Well, let's take a